obviously from your profession, you will know this very well, that this has been circulating, this whole narrative that, well, pro-life laws are putting women's lives in danger, and essentially saying that this is outlawing miscarriage care. So, and specifically, I'd love if you could talk about, the way that it's coded for insurance. A miscarriage is called a spontaneous, at least the last that I had read about that. So, are women's lives really being put in danger from pro-life laws?
The pro-life laws have not put women's lives in danger at all. And I'm just going to read from you. Florida has a heartbeat law. We went from 24 weeks to 15 weeks to 6 weeks. We have a heartbeat law. And before a physician performs a procedure, if in their reasonable medical judgment, the termination of pregnancy is necessary to save the pregnant woman's life or avert a serious risk of a substantial or irreversible physical impairment of a major bodily function of a pregnant woman, then a termination of pregnancy can be performed. Then it goes on to say that if it's an ectopic pregnancy, a tubal pregnancy, then yes, perform the procedure. If it's a miscarriage without heartbeats, then you can perform the procedure to resolve that condition. Even when it comes to procedures like molar pregnancies, which have a positive pregnancy test, but this is not a pregnancy which is going to result in a baby. There is no limitation and there is no delay. When we were going through the heartbeat law here in Pensacola, in Florida, there were actually physicians who were going on ads and say, if a heartbeat law is passed, I'm not going to be able to perform a D&C for a patient at a miscarriage. Or if she has an ectopic pregnancy, my hands are tied. I can't treat that life-threatening ectopic pregnancy. Governor Ron DeSantis fired right back. He sent a letter to every licensed physician in the state of Florida saying, knock it off. These are lies. You know they're lies. They're being deceptive, and stop it right now. And so there are no limits. If the mom's health and life is in jeopardy, then yes, the procedure can be performed. And all you got to do is read the laws. And I guarantee you, if these physicians went through college and they went through medical school and residencies, they are literate. All they have to do is read the actual law to dispel. Now, what is putting patients in danger is the abortion pill, because the pill is now performed. 64% of all abortions are performed with the abortion pill, and the abortion pill will kill a baby in the womb up to 10 weeks gestation. Yet we are having women dying from taking the abortion pill. One of the more famous cases was a woman in Georgia named Amber Nicole Thurman. Amber was pregnant, and she realized that Georgia has a heartbeat law where you're pregnant, you can't get an. They're defending and protecting the patients on the inside of the womb. There are lots of resources that are available to help moms, but you just can't get your baby. So she actually made an appointment in North Carolina. She had an ultrasound, said she was pregnant with twins and about 9 weeks along. She ran into traffic while driving from Georgia to North Carolina. She ran into a lot of traffic and she arrived late, and they were not able to perform a surgical for her. So they offered her the pill. The pill can only be taken up to 10 weeks, and so she was right at that edge. They gave her the pill, and then there's a series of pills to take the next day as well. And she drove home from North Carolina to Georgia. Did the clinic in North Carolina even call her to say, hey, how you doing? No. Amber got home to Georgia. She started to have bleeding, but then she thought she was having the at home, but then she started to get a fever. And then 3 days later, she says, I'm sick. And she went to a emergency room of a local hospital. The ultrasound was performed there at the local hospital. And yes, she was pregnant with twins, but neither baby had a heartbeat. Both babies were already dead, but the babies were dead and the tissue was still there on the inside. Amber was getting sick from an infection from dead necrotic tissue. They consulted the OBGYN who was on call. The standard of care would have been, number one, go and do a history and physical and see your patient, and then start antibiotics. And if the babies are both dead, do a D&C, empty out this infection that's on the inside of the uterus. Well, he didn't even see her for 20 hours after she was admitted to the hospital. He realized she was really sick. She was becoming septic. They were having trouble keeping her blood pressure up, and they took her to the operating room thinking, well, let's do the D&C. She was really fading fast. So they didn't just do a D&C. They ended up doing a hysterectomy. When they were in the inside, doing the hysterectomy would have kept her from having any babies in the future. They realized the infection had spread to the bowel. They tried to treat that. Amber Nicole Thurman died right there. She didn't die because of a heartbeat law because neither baby had a heartbeat. You see politicians saying that she died because of Georgia's heartbeat law. How can a heartbeat law even remotely come into play when neither baby had a heartbeat? She should have had that D&C. Amber Nicole Thurman died because she was given poor care and the standard of care was not upheld. It wasn't because of Georgia's heartbeat laws, but we're seeing more and more women coming in with side effects and being injured and some dying from taking the pill. And even when the women are given the pill, they're told that if you go to the ER, don't tell them that you took the pill. So you're denying the physician in the ER very vital information of what's been transpiring, what's been going on. I mean, would you say don't tell somebody you're allergic to penicillin? No, we need all the information possible. So it's really tough to see how many women have complications from taking the pill because they're specifically told, don't tell the physician that you took the pill. I'm not going to bring any judgment. No physician is going to bring judgment. If somebody did an illegal drug, I don't care about whether you did an illegal drug. I just want the information so I can fix you and I can cure you. So it's tough to tell, but we're seeing more and more reports, and especially now that something as basic as an ultrasound is not being performed, you can now not only get the pill available mail order, you can get it mail order from China. You can get it mail order from India. And we're seeing more and more complications. Only about 30 to 35% of women really have a good idea of how far along they are when they are pregnant. Maybe they're a little bit, further along than they thought. It could be 3-4 weeks further along than they thought. So we're having women who have taken the pill, were they up to 10 weeks? No, sometimes they were 14 weeks. The pill might be strong enough to take the life of the baby, but the medicine the next day might not be strong enough to deliver that baby. But the other thing is that the number one pregnancy-related cause of death nationwide in the first trimester of pregnancy is a ruptured ectopic or tubal pregnancy. Just having 2 lines on a pregnancy test only says there's a pregnancy. Doesn't tell you where the pregnancy is. And statistically, nationwide, 1% of all pregnancies will be ectopic or tubal, the fallopian tube being most common. The tubal pregnancy is a cause of damage and death of women, but the pill will not treat an ectopic pregnancy. So when a woman receives the pills, she's told you can expect to have bleeding, cramping, and pain. And they walk away with those instructions of what to expect. What are the symptoms of a rupturing tubal pregnancy? Bleeding, cramping, and pain. The symptoms are the exact same. So when a girl has a positive pregnancy test and she is scared, a lot of times they don't tell their friends, they don't tell their parents, they are going through this alone. And then there have been cases where parents have found their daughters dead. They didn't even know they were pregnant. They didn't know they had taken the pill. And then the post-mortem exam shows that, yes, your daughter was pregnant. Yes, it looks like she took the pill, but the pregnancy was inside of her tube. It ruptured and she bled to death. Your daughter is dead because of an ectopic pregnancy. When she had that pain, she probably would have gone to the emergency room because something was definitely wrong, but she's been told you can expect to have bleeding, cramping, and pain. It's just bad medicine. Half the patients are going to die. I mean, the babies in the womb are my patients. We've talked about that. So when you have half of the patients dying, but you have women being injured as well, I mean, that's just not good healthcare. That is bad medicine. And the industry is kind of looking over and not addressing the risks and the complications to not only these babies dying, but to the moms as well. I mean, it's just not something that should be available. Mail order from other countries. We have people dying. We had over 120,000 people die of drug overdoses last year. And we have an antidote for that, which is Narcan. Well, we have a lot of people that are being hurt and dying from the pill. It's bad for moms and it's bad for babies, and we need to stand up for good health care.
Yeah. Yeah.